Good morning. So welcome everyone to the second day of the 17th Welfare Research and Evaluation Conference. I'm Mark Fuccello. I'm the Director of the Division of Economic Independence in the ACF Office of Planning, Research, and Evaluation. So as Naomi explained to you yesterday, my team organizes this conference, and to say they do a terrific job is an understatement. And I want to especially thank once again the leaders of the team who put this entire thing together, Hillary Foster and Erica Zalewski. And they really, my entire team, including everyone else, we had an interesting year working in the federal government and the public sector generally. And as many of you know, we deal with resource constraints and tight deadlines, and then a shutdown thrown in on top of that. And then my folks have to endure a daily shameless deluge of my baseball quotations and metaphors. And it's more than I think they can put up with sometimes. But I have to remain constant to my themes. So today's quotation is from Casey Stengel. And for those of you not steeped in baseball lore, he led the New York Yankees to 10 consecutive pennants and 5 consecutive World Series championships. And Casey said, "Managing is getting paid for home runs that someone else hits." And in my case, that is certainly true. So we have a great agenda for the day, and we have some special events that I want to point out to you. At 2:30 will be facilitated roundtables. We'll hold 16 simultaneous facilitated roundtable discussions in rooms that are listed in the conference program book. And these roundtables will offer you an opportunity to have discussions facilitated by someone that we've worked with on particular topics, and there really are a wide range of topics, from asset building in Native communities to how behavioral diagnoses are done in behavioral interventions, to best practices in research dissemination, and many more. So we hope that you will attend the ones you find most interesting. Once you've identified one, go to the room, look for the table where the session topic is listed, and organize yourselves around that table. And if a group is so large that you need more room, please feel free to just use the space as you like and spread out, pull tables together if necessary. At lunchtime, there will be 2 different events. One is called the Munch and Mingle Lunch Gathering. So we invite you to bring your lunch and to gather in the back of the Independence Ballroom for informal networking and discussion. Food and refreshments are available, of course, down the hall and elsewhere around the neighborhood. And I hear there's a thunderstorm headed for us at noon today, so you might actually plan on doing that. There will be a special brown bag presentation at the lunch hour that's not listed in your program book. It is a presentation on ACF's Job Search Assistance Strategies Evaluation, and the TANF administrators, I think, got a heads up on this. But if you're interested in learning about ACF's Job Search Assistance Strategies Evaluation, which is being led by Apt Associates, this will be an opportunity at 11:45 in Independence HI is the room. The project is currently recruiting evaluation sites, so this is an opportunity to talk to the evaluators and my staff about your program's interest in possibly participating in the evaluation, and you can hear generally about the study plan. The study will provide critical information to TANF policymakers and administrators on what components of job search programs are most effective in helping TANF recipients find and keep jobs and potentially obtaining better jobs. So feel free to bring your lunch to that session. In addition to all of that, we have 2 rounds of breakout sessions planned for the day at 10:15 and 1 p.m., and then at 4 p.m. we'll be back here for a plenary on how to improve skills among low-income populations. A reminder about live stream instructions. For those of you who are viewing us via live stream, you can send questions to panelists via the email at reclivestream@gmail.com, or by tweeting with the hashtag RecLive, or directly on the REC live stream site via the Submit a Question button. So now let's move on to our first panel. I'll ask them to come up in a moment, and I'd like to introduce the moderator, Ben Odell. We'll hear a discussion about exploring fatherhood and the transition to adulthood for low-income men and youth. Ben is an associate director at the U.S. Department of Health and Human Services Partnership Center, where he facilitates partnerships between faith and community groups and the federal government to better serve individuals, families, and communities. Through his work as associate director, he works directly with the White House to promote fatherhood and healthy families and supports a wide range of center efforts, including the President's My Brother's Keeper initiative and the First Lady's Let's Move Faith and Communities initiative, and also enrollment initiatives related to the Affordable Care Act. He received his master's in organizational development from the School of Public Policy at George Mason. So I'll ask Ben and the rest of the panel to come up.
Good morning. So as a part of my opening remarks, I'm excited to give you just a few ideas and thoughts related to an initiative that we've been working on very much for the past few months, known as My Brother's Keeper. As a part of the announcement of that work, the President asked a question that I would bring to us today, and it's a question we've been wrestling with for the past 90 days. He said, there's a lot of kids out there who need our help. Is there more we can do to give them the sense that their country cares about them, values them, and is willing to invest in them? As a part of the President's new initiative that brings together leading foundations and businesses, he's put a spotlight on young men and boys of color and asked what we can do through a collaborative, multidisciplinary approach to build ladders of opportunity and unlock the potential that has sometimes been kept within our young men and boys of color. We see this from research, specifically that focuses on boys and young men of color, that regardless of where they're from, they're disproportionately at risk from their youngest years through college and in the early stages of their professional lives. Reading assessments analyzed last year by the Department of Education show that by the time boys hit 4th grade, 86% of African American boys and 82% of Native American and Hispanic boys are reading below proficiency levels. That's compared to 58% of white 4th graders reading below proficiency levels. For African American and Hispanic young men, they are 6 times as likely to be victims of murder as their white peers and account for almost half of the country's murder victims each year. The need was great. And so the President asked to work alongside 10 foundations that stepped to the plate to launch what they call the Executive Alliance to expand opportunities for men and boys of color. And it's seeking to invest $200 million over the next 5 years to find and rapidly spread solutions that have the highest potential for impact. That's on top of the $150 million those organizations have already committed as a part of their portfolios to have an impact in this space. Alongside that effort, the President has formed the My Brother's Keeper Task Force, made up of 19 federal agencies and White House offices to align their efforts with the foundation community in a 3-stage process that is presently underway. Within 30 days, this group was asked to provide indicators of life outcomes for the public website and a plan for providing that data on such indicators. As a part of the discussion on indicators, there's a potential for individual states and local communities to identify how indicators for young men and boys are doing in their respective communities. So it's not just going to be a national data set, it's going to be something that is scalable into each community potentially. Within 45 days, there's been work to identify relevant programs and data-driven assessments for consideration in a listing of private and public programs that have an impact or are having promising results that would make an impact for this population. And then lastly, in 90 days, which we'll reach very soon, the federal agencies are providing the president with a report with recommendations and ideas of what are going to be put forward as a part of this initiative. Within this structure, we're focusing on a couple of key areas, and I want to highlight those real quickly. Critical junctures on the path to healthy and productive fatherhood that certainly have an impact for our discussion today. The first stage is early learning and literacy, focusing at the earliest stages on how we can help young boys get ahead, not just behind the system, but ahead of the system, with opportunities for reading, for literacy, and just as many educational opportunities as we can pack into those first 5 years as possible. As a part of that, that sets them up for success in pathways to college and career, and thinking through pathways and systems and programs that are strengthening opportunities for job preparation, job training, and really helping young men find work. That leads to our next step of not just leading to work, but actually getting those jobs and providing ladders to opportunity into employment. As a part of all of these stages, we know that involvement in criminal justice and violent crime creates certain challenges for young men and boys, especially for those young men and boys coming from communities of color. And so there needs to be an assessment, a lot of work that's being led by the Department of Justice to look at how we can promote reforms and changes in those systems to consider how best to work and to promote opportunity. And lastly, as a part of across all these stages, we're really looking at how parents can be empowered, parents can be strengthened, including fathers, as well as other caring adults, such as mentors, who can be involved in children's lives across that lifespan, where we're focusing very much on young men and boys 0 to 24 years old. So that brings us, that focus on parents, that focus on fathers, brings us to our conversation today, and where fathers and families and looking at those transitions to adulthood relate to My Brother's Keeper. To think through how to engage parents from low-income families from communities of color, especially fathers from those communities, we need to understand more about where these fathers are. How are they already engaging with their children, and what supports are they providing? What are some of the barriers they face to being involved and supportive, not only for their children, but also for their partner parent of the child? These questions are important because how fathers think about themselves and how families think about them is changing or has changed for many. Just as family is changing, is becoming an increasingly complex web in many of our communities, fatherhood and how it is understood, defined, and expected is changing as well. These complexities are challenging to describe, perhaps harder to measure, but are important for policy and research as we consider how better to serve fathers, families, and children. That's one of the many reasons we have Kathryn and Tim here with us on this panel today, to tackle challenging questions and wrestle with the key mysteries about urban poverty that have not been fully answered by quantitative work. Some of these questions that they've wrestled with have been, how do single mothers survive on welfare? Why don't more go to work? Why do they end up as single mothers in the first place? Kathryn's research has asked the question as well, where are fathers and why do they disengage from their children's lives? Kathryn and Tim's work is giving us a firsthand glimpse into this world with complex and deep understanding from families with whom they have worked as well as lived. They're going to give us a sense of that work today, and I'm excited to hear more about it. As such, let me provide a little bit more of their bio to give you a sense of where they're coming from. We'll go over David's bio, and then we'll jump right into the panel as well. Kathryn is one of the nation's leading poverty researchers, working in the domains of welfare and low-wage work, family life, and neighborhood context. Dr. Edin has authored 5 books, with a 6th forthcoming, and 50 journal articles. The hallmark of her research is her direct, in-depth observation of the lives of low-income women and men. Her books include Promises I Can Keep, Doing the Best I Can, and It's Not Like I'm Poor, Making Ends Meet in the Post-Welfare World, which is her forthcoming book. Dr. Edin's current research projects includes a study of the rise of the number of American families living on less than $2 per a day. Dr. Edin is the Margaret Mead Fellow at the American Academy of Political and Social Sciences, a trustee of the Russell Sage Foundation, and on the U.S. Department of Health and Human Services Advisory Committee for the Poverty Research Centers at the Universities of Michigan, Wisconsin, and Stanford University. She holds her BA in sociology from North Park University and an MA and PhD in sociology from Northwestern University. Tim Nelson is a senior lecturer at the Department of Sociology and a research associate in the Department of Population, Family, and Reproductive Health at the Bloomberg School of Public Health at Johns Hopkins University. He's the author of numerous articles on low-income fathers and is the co-author with Kathryn on Doing the Best I Can. Currently, Nelson is working on a book with Kathryn, and Laura Lean at the University of Michigan on the work and child support services of 440 low-income fathers interviewed across 4 metropolitan areas: Philadelphia, Charleston, South Carolina, Austin, and San Antonio. He is also working with Andrew Cherlin at Johns Hopkins University on a project examining the intersections of family, work, and religion in the lives of working-class fathers. His prior research has focused on African-American religion and congregational studies, and his prior book in that space is Every Time I Feel the Spirit, Religious Experience and Ritual in the African-American Congregation, which was published by NYU Press in 2004. He received his PhD in sociology from the University of Chicago in 1997 and has taught at Northwestern University and the University of Pennsylvania. But after we developed that understanding and perspective that has come from their research that we're going to hear more about, we need to be thinking about how to connect that work to programs. And as we move forward, both with research from fathers and with My Brother's Keeper, we need to consider the connection between services to parents, especially fathers, and their children. Fathers matter in and of themselves. We need to consider, as some of the work David is doing, on how we can serve them and connect them to services and support. But we also need to be looking downwind of those interventions to do the hard work of getting data sets that connect those, that research, that work, those interventions to child outcomes. David's going to tell us a little bit more about the research that he has underway that is wrestling with some of these research challenges by connecting men through WREC programs and thinking through how we can find some of those connections between fathers and families there at those sites, connecting children with fathers. And he really sits in that work and so much of the other work he's done at the intersection of research and practice. He's an associate professor at the social work. David Pate is an associate professor of social work at the University of Wisconsin-Milwaukee. His fields of special interest are welfare reform policy, child support enforcement policy, fatherhood, domestic violence, and the intersection of race, gender, and poverty. He has over 20 years of direct service, management, and policy experience in the field of social work. Dr. Pate's research projects involve the use of qualitative research methods to examine the relationship of non-custodial fathers and of children on welfare and their interaction with their children, the child support enforcement system, and mothers of their children, and the incarceration system as well. Prior to his appointment at the University of Wisconsin-Milwaukee, he was the founder and former executive director of the Center for Family Policy and Practice, and also held his postdoctoral research fellowship at the Institute for the Research on Poverty at the University of Wisconsin-Madison. He received his bachelor's in social work from the University of Detroit, a Master of Arts in social work from the University of Chicago School of Social Service Administration, and then earned his PhD in social welfare at the University of Wisconsin-Madison. So with that, let me turn it over to Kathryn. We're excited to hear from you first, and then turn it over to Tim, and finish up with David. Then we'll have a chance for questions from the floor and from the live stream as well.
Good morning. So before I begin, some acknowledgments are in order. First of all, I'm thrilled to be sharing the stage with Dr. David Pate. He's been in the trenches talking with fathers for far longer than we have, and it's wonderful to have him here. Second, one of the foundational pieces of research that undergirded our efforts was written by Dr. Earl Johnson, who I believe is in the audience, and I commend his book on Parents' Fair Share to you. So thanks to both of you, and thanks to all of you for being so, as my father would say, bright and bushy-tailed this morning. So the problem of father absence among young, disadvantaged, unmarried men has been the focus of public rhetoric for a long time. And let's look at how various folks have diagnosed this problem. First of all, we turn to David Blankenhorn, who in his book, Fatherless America, wrote the following. Unwed fathers never signed on to anything. They never agreed to abide by the fatherhood code. They have never had any explicit obligation either to their children or to the mothers of their children. Okay, and here unwed, in the United States, unwed fathers are predominantly almost wholly fathers who are disadvantaged and men of color, although more and more white men are having children outside of marriage as well. William Bennett has also diagnosed the problem. In his book, The Broken Hearth, he wrote, "It is unmarried fathers who are missing in record numbers, who impregnate women and selfishly flee. And it is these absent men, above all, who deserve our censure and disesteem." Now, on the other side of the political aisle, we have the following comment from Bill Cosby. "No longer is a boy considered an embarrassment if he tries to run away from being the father of an unmarried child." And finally, from our own president, "Too many fathers are missing from too many lives and too many homes. They've abandoned their responsibilities, acting like boys instead of men." We need fathers to realize that responsibility does not end at conception. We need them to realize that what makes you a man is not the ability to have a child. It is the courage to raise one. Strong words. But is this the right diagnosis of father absence? Is it simply that men want to act like boys? Is it simply that young men of color want to selfishly flee? Or is something else far more profound and important going on? Now, before we delve into the answer to that question, we want to do a little demography 101. When I'm not being an ethnographer, I moonlight as a demographer. These data are from the Fragile Families and Child Well-Being Study. And I simply want to make the point that we need to understand the kind of families fathers are in before we can figure out how to diagnose the problem of father absence. The typical father is not in the kind of family that is inside of the circle in this picture, a simple family, but instead he is often in a highly complex family, fathering children across multiple households. Okay. Now the question for policy is, how well are these young men managing this complexity? Now, following Robert Lerman and Elaine Sorensen, we look at this question in two ways. First, and this is from the National Longitudinal Survey of Youth, 97, again, my demographer side, we ask dads, tell us about the kid you're most involved with and describe your involvement with that child. Now, these are young men aged 26 to 30. If we look at even younger men or slightly older men, we see the same story. 85% of those with children in more than one household, in these complex families that I showed you just a minute ago, are actively engaged in their children's lives, seeing their children at least weekly, often almost daily. So this is good news, right? But wait a minute. What if we ask these same men, tell us about your involvement with the child you're least involved with? And here we see that half of unmarried men will be intensively engaged with one of their non-marital children are simultaneously almost completely disengaged from another. In Doing the Best I Can, we tell the story of how men managed to accomplish fatherhood. Now, we're not endorsing this, we're describing it. They managed to accomplish fatherhood through a process of serial selective fatherhood, which simultaneously enables them to feel good about their roles as fathers, but leaves many children behind. Okay? So let's go to the field, give you a real example of the 110 men we spent 8 years following in Philadelphia and Camden. David Williams had a relationship with a woman who produced 2 girls, one 17 and one 18. He sees these girls about once a month because he runs into them in the neighborhood. They live close by. And he only supports them by bringing presents at holidays and on their birthdays. He also has 2 sons with another ex-partner. These sons are 11 and 12, and he hasn't seen these children for 5 years, providing nothing for their care. So by the lights of these 2 households, David could be deemed a deadbeat. However, look at his relationship with his son Julian, only 1 year old, by his partner Deborah. He's fathering this child intensively. You're going to hear a quote in a little bit about how deeply David feels about his son Julian. And he's also parenting Deborah's 2 children by another prior partner, providing for most of their financial support by 2 menial low-wage jobs. So, if we look in the household that David is in right now, we might think of him as a model father. So, Doing the Best I Can is a complex story of how this occurs. But what we're going to share with you today is one piece of bad news and one piece of good news, both of which I think suggest directions for policy. Now, the bad news is that most kids these men father are fathered in very, very fragile relationships and in circumstances that are far from ideal. This leads to rapid breakups and very, very difficult, contentious co-parenting relationships that are almost doomed to fail. But the good news is that these pregnancies produce, spark a strong father thirst and a strong desire to father intensively and father well. Both the bad news and the good news of this story give us direction for where to go. So I'm going to tell you the bad news. And Tim, who's also my spouse, if you wondered why we lived together in Camden, we weren't cohabiting, we were married with our 2 girls. I'll tell you the bad news, and he can finish up with the good news. And then we'll conclude by thinking a little bit about how we can use this information to move forward. So the typical process of relationship formation is as follows. Let's listen first to Amin Jenkins from Strawberry Mansion in Philadelphia. And he's describing the process of courtship, if you could call it that, with his youngest son's mother. Well, my youngest son's mother, I met her at the University of Pennsylvania Hospital. She was attracted to me when I first saw her, and I made my approach. We began to socialize and communicate. And from there, we began to affiliate. And at some point in time, we became intimate. And my son was born. Now, what's remarkable about this quote is what it doesn't contain rather than what it does. No mention of love or commitment. Antoinette just happened to be the woman who became the mother of his son, Antoine, in just a few months' time. Let's go now to John Carr from Fishtown. Actually, she, the mother of his child, was dating a friend of mine, and somehow she wanted me. But it was my friend's girl, so I didn't want to do nothing to do with it. But then my friend heard some shit and started talking. By the way, I'm from Minnesota, Swedish Lutheran background. Sometimes I think I went into this world so I could swear in public. and started talking shit and saying he would kick my ass. So I was like, whatever, then I will be with your girl. Eventually, I just got stuck with her for a little while. This is how he describes the relationship with a woman who would give birth to his child in 13 months' time at the Cape May Regional Medical Center. Tim O'Brien from Kensington. I was hanging out at a friend of mine's house, and her and a couple of her friends were there, and she used to go out with my friend. My friend was trying to get her back, and I ended up getting with her. We were only together for about 2 months, and she was getting pregnant. I didn't mind at all. So notice, just 2 months' time, Tim O'Brien didn't choose his child's mother. He just ended up with her. Finally, Will Donnelly from Fairmount. I had just come out of a juvenile institution. I think I had just turned 17, and I started going with her friend. Friend poaching is apparently common. And one day she came around and we started talking, and I went with her and left her friend. And then me and her got together and we started having kids together. And then we got closer and closer. Then we started living together. So what you see here is a reverse of the traditional pattern. Having kids together is something you accomplish before and not after you get closer and closer. And before and not after you start living together. In many ways, the relationships these young men end up in are an outgrowth of a pregnancy. The pregnancy is not an outgrowth of the relationship. But the news of pregnancy stokes the transformation of a relationship from a casual liaison to something more. So here we return to David Williams. When I was first with Deborah, I had a girlfriend on the side too, Kathy. She was someone I met at Narcotics Anonymous. We got close and we started helping each other with our addictions. One thing led to another and we got intimate. Me and Deborah would get into an argument. She'd tell me to leave. I'd go stay with Kathy. We asked, how did you end it with Kathy? Deborah got pregnant and I had to do what was right. So this doesn't sound like much of a relationship, right? What about when David hears the news that Deborah's pregnant? Each month of the relationship, of the pregnancy, you know, we got closer and closer. I wanted to be with her more. And then 2 or 3 o'clock in the morning, she had me running to Pathmark, buying different foods. So that brought us closer too. And then watching him born brought us even closer. On her last push, he came out spinning like a bullet. Nothing was more beautiful than Julian. The way he came out of his mother, that was amazing. And I held him, and I didn't want to let him go. So the process of relationship formation revealed in Doing the Best I Can is one of short courtship, only 6 to 7 months of kicking it, talking to each other, affiliating, to use Amin Jenkins' word, communicating before the first pregnancy leading to a live birth. When men are asked whether their pregnancies are planned, they typically say, I just wasn't thinking at the time. And one thing led to another. Typically, it is pregnancy that prompts the transition to a relationship. It is not the relationship, a reflection of commitment in a relationship, that prompts pregnancy. But these relationships are fundamentally all about the baby, and both the mother's and the father's orientation is about building the relationship with the child, not so much each other. It is for these reasons that although about 80% of couples arrive at the hospital saying they're a couple, half break up in the first year. More than 2/3 will part by the child's 5th birthday. And the highly contentious co-parenting relationships that result will often spurn fathers' efforts to stay involved with their children. At the same time, the same process of relationship formation will produce new children with additional partners and competing obligations like those that David Williams is struggling with. So now for the good news.
Good morning. I get to do the fun part of this presentation. And by the way, writing a book with your spouse, highly recommend it, actually. It's a very good bonding experience. So, okay. So think back to the quotes that Kathy read at the beginning about the diagnosis of the problem, about men, as soon as a girlfriend comes up pregnant, selfishly fleeing and leaving the mother holding the diaper bag. When we first went into the field, that was kind of the story that was out there, and that was what we approached our initial interviews with. And then we started hearing answers to the question that we posed here. So every father that we interviewed, we asked about each of the pregnancies that he was aware of, and asked them to tell us the whole story of how he found out that she was pregnant and what his initial reaction was. So this was the actual question we asked. Think back to when you first learned she was pregnant, what was your first reaction to the news? And then we kind of took the narrative that the fathers gave us and divided it into these categories that you see here. Now, what was interesting is that of this list of categories, almost all went into the accepting or happy category. And just to give you a sense of the flavor of some of the quotes, actually, that indicate this incredibly positive response to the news of a pregnancy, I have some here. I don't know if you guys are able to see this, especially in the back of the room here, so I'll just read some responses. Robert says, I was excited, but then I thought, I got to get out of here and support her. Ozzy, a white father, said, I always wanted one, meaning a child. Tim says, I didn't mind at all. I was happy. At the time, I thought I cared about her. I thought I really loved her. Wilbert, a black father, says, I was so happy, even though in the back of my mind, I wondered, is it mine? So there's sometimes a lot of mistrust and things in the background, but even in spite of that, he has this incredibly open, positive attitude. I think I've got some more. Yeah, so 7, another black father says, my first son, I really looked forward to having him. And so you see the word happy, you see the common theme that runs through all these things. And like I said, the vast majority of the responses then were very positive. And this was particularly noteworthy because, as Kathy said, these were pretty new, pretty fragile relationships that these pregnancies were coming into. And often these fathers were not in any kind of situation which we would think would be ideal to bring a child into the world. A lot of these guys had not completed high school. They were minimally employed at best. Some were dealing with substance abuse issues. A few fathers were actually on their way to prison when they found out that they were going to become fathers. So, and in fact, that is part of the story, is that part of the response, part of this welcoming, happy response, is due to their circumstances. So let me explain that a little bit. This comes out when in the responses to another question that we asked of every father. We asked them to contemplate, what would your life be like now if you didn't have any children? And we expected that at least a good portion of the fathers, given their circumstances, would say, oh man, I wouldn't have to worry about child support. I wouldn't have to be so stressed out as I am. You know, I would have stayed in school, because a lot of fathers left high school when they found out that their girlfriends were pregnant in order to get a job. But what we ended up hearing were stories of salvation, to put it into a nutshell. In other words, having a child, and this starts in the first news of the pregnancy, kind of gave these guys a reason to turn their lives around, to get themselves together, to go looking for work, to finish that degree, to take care of some substance abuse issues and other kinds of things. So this is the preponderance of the story. So this slide has African American fathers, Kevin saying, without my child, I'd probably be in jail. Q, I'd be dead because of the simple fact that it wasn't until Brianna was born that I actually started to chill out. And you can see, the pattern in this. John says, I don't think I would be as happy as I am now because my kids make me feel totally different. I feel more like a man. And so those are the African-American fathers, white fathers had essentially the same story. Tony says, I'd either be dead or probably would have went to college. So two very different pathways there. I'm saying dead because I think she's the only thing that made me stop using. He was a heroin user before his child was born. Walt says, I would be dead. I would have killed myself a long time ago. I already tried suicide twice. And the Latino fathers who don't actually appear in the book Doing the Best I Can, but we also had a Latino sample. Again, you hear the exact same story. Raphael, if he wasn't born, I would probably be out in the streets, et cetera. So very powerful narratives of how children gave them the impetus to turn their lives around and gave them something to live for. One of our fathers named Elvis, I'll just tell you, just to highlight his interview a little bit. We asked him, what did you think your future was going to be before you had little Elvis? That's his son. I wasn't going to live past the age of 30. And then once you had him, I can't even picture my life without Elvis in it. I had already made a promise to myself. I had told my friends, I don't want to live past the age of 30. If I make it to 30, I'm going to take myself out. Then he came into the picture when I was like 27, and that all changed. Everything changed. My whole life changed. And we also have the story of Lacey, an African-American father, who we asked, what would your life be like if you hadn't had your children? I can't imagine that one. I really can't, because my life without them, it would be empty. It would be empty, because that's what kept me going, knowing that I had to come out of jail and be there for them. How did you see your future before you became a father, we asked him. I didn't have no future. I didn't care. I lived for the moment. Did you think you would live to see 42, his current age at the time we interviewed him? Nope, nobody expected me to be there to see 17. Did you imagine that you'd do something career-wise? No career. I'd be a big gangster. So you can see the sort of dramatic transformation that at least some of these fathers had in the wake of a pregnancy and a birth. And again, Nelson Rios, talking about his children and the love that he feels for them and that he feels from them, says, it's like a drug you got to have. All right, I'm going to just turn it briefly back over to Kathy, who's going to tell you the solutions part of this presentation.
So as you can see, fatherhood is a moment that may have tremendous potential to help men turn their lives around. But all of these good intentions, the father thirst stoked by a surprise pregnancy, is at war with this process of relationship formation that produces children in fragile relationships, in fragile circumstances, that then leads to rapid breakups and highly contentious co-parenting. So what do we do? I think there's tremendous potential to educate young men, and we go around the country talking to young fathers. They agree with this, to helping them think about how to plan their pregnancies. 80% of these pregnancies are unplanned. We believe all pregnancies should be intended. That's hard in the United States, where half of all pregnancies are unintended or not perfectly timed. But getting young men to think about how to satisfy this father thirst in planned ways, in more stable relationships, and in more stable circumstances is critical. And of course, we have to make this possible for young men, especially the economic part. But second, we should really capitalize on this father thirst. Not only would children benefit from having their kids, from being more involved, having their fathers more involved in their lives, but fathers could benefit tremendously. If we can transform the process of relationship formation and remove the substantial institutional barriers to fathers' contact with their children throughout the life course, we may not only transform children's lives, but their fathers' lives as well. And I will now turn to David Pate.
Good morning, everyone. Thank you, Kathryn and Tim, for your excellent book. I told Tim, Kathy, that I wanted you to sign my book because if I like something a lot, I want to have the signature of the person in the book so I can remember. So I really thank you guys for your book. And also thank you for the recognition of having the opportunity to speak to you. What I'm going to do today is talk to you about 3 different projects that I'm working on right now, hopefully going through it really fast because I know we don't have much time, but giving you a glimpse of 3 different ways I'm trying to examine how often are men involved in their children's lives, what are some of the challenges that these men face in terms of their own well-being, and also what is the social policy, that particularly being child support, that may hamper their ability to be able to provide assets and wealth to their children. I think that what I have tried to do, did I do something wrong? Oh, I turned, okay. What I want to do first is acknowledge all of the research team that I work with. I've learned over the years, as someone who was a former practitioner and has come into the academic realm the last 10 years, that you can't do this by yourself. And so I've learned to pull together a significant research team in this last 2 years in particular to help me with the work. And I want to acknowledge my co-investigator, particularly Dr. Topetsis, who has been a very valued member of the team, and also my doctoral student who works really hard, and all of the undergrads who have been really excited to do work in the field and to learn how to collect data and do interviews. It's been really fun. Also, I want to acknowledge all of my funders. I'm happy to say that yesterday I was awarded an NSF grant to do some work, which I was shocked by. So I want to add them on that list as well. So again, I want to thank all of them for recognizing this work that I'm doing too, also in the world, in the area of fatherhood. I want to start out with a project that it has a lot of data on it, and hopefully if you want to get these slides, they'll be available to you. But I was approached by a WREC site 2 years ago that said, David, we have a lot of men who we think come through here. We're not really sure, but we were wondering if you'd be interested in providing us with some research or a way of collecting data as to how many men provide some type of accompaniment or service, or what can we do better to engage men at a WREC site? Well, of course, at a WREC site, it's women, infants, and children. So you don't think men are going to be there. So we decided that we would collect some data. We did a mixed methods type of data. We did surveys, and we also have done some interviews and focus groups. But what we initially wanted to do was just see who was coming through the center for services, or at least how many men are coming through the center. But one of the men I interviewed, I'm going to start out with this first. One of the men I interviewed, I asked him, what do you think about your role as a father? What do you think about the services that are available to you in a city like Kenosha? Kenosha is also a city where they have a very high rate of infant mortality. It's very depressed. Unemployment rate, even though nationally for black men is 12, 13%, in this particular city is about 50%. So there's a really there's a really big issue of how do they define themselves as men is generally by being a breadwinner and having a job. But for men who have very low education ability or low job skills or have been incarcerated, that makes it very difficult for them. So he said to me, I'm not trying to say men are innocent, but I mean women get a lot more help than guys here. Guys tend to struggle a lot more. And really pretty much the system just looks at you as either you're in a gang or you sell drugs or that type of atmosphere. If you live on this side of town, pretty much everyone over here does the exact same thing. The police is like they sweat you for pretty much anything you know. When I was growing up, I used to see that a lot. I mean, they don't have things for guys, but it's kind of limited. They do have things for guys, but it's kind of limited because they look at you as a male. You should be able to provide for yourself, And so this whole definition of what does it mean to be a man and how do you define manhood is really much as something that permeates throughout a lot of the discussions I had with these men in many cities, in many parts of Wisconsin, throughout the country. How do you define manhood and how do you redefine manhood in a time when there's not very many jobs for this particular population of men that we're talking about here? Going back to looking at just how many men were coming through the center, we were able to just document through a system called ROSI that's a part of the statewide Wisconsin system of a 6-month time period. We saw that over 1,300 men were coming through the WREC site. Just dropping off their kids, sitting in the lobbies, going through the visit with the mother. And 993 of those visits were unduplicated visits. So over 900 individual men were coming without any services available to them except to be as a supportive help to the mother who was with their child. in common. We found that this population was mostly white and Hispanic. There was a small black population of men who were coming through. We also found that most of these men were very young, which very much goes to what Ben was talking about in terms of look at my brother's keeper. What can you do for those younger fathers who are now starting out to be parents? Because this is a place where they're coming, their children are under 5 years of age, but there was really no services that they really could get except to be looked at as that's the father, but nothing to give him in terms of what he really needed. So we developed a survey, a 35-item survey, pencil survey, and asked them just to give us an idea of who are they, what do they want, what do they need, so that they're able to get services. When we asked them about why were they coming for the visit, one, just because they wanted to be there with the mother for the infant or child that was their child in common. They were there to pick up and attend nutrition sessions. They were there just only to pick up, so they were waiting for her to finish with her appointment. Some of those men were waiting in the waiting room just because it was something to do and they had nothing else to do, but they really wanted to be around with the mother of their child. There was an appointment that the mother couldn't take the child to, or there was a pending pregnancy and they wanted to make sure that they were there for that, or to come in to schedule an appointment. So that gave us a little better idea of how can the system or how can the employees also be more involved and engage in these men. Also, what we found is that we had to have a significant number of sessions with the staff because many of them were not as accepting of these men who were coming to the WREC site, or were not even acknowledging them. Many times the men in the focus groups and survey and the interviews would say to me, I would be in the room and answer the questions that she would ask the mother, and then the mother would have to say to the nurse, ask him, he knows it better than me. He's answering the questions. So just the simple recognition that he may be just as involved is something that they had to struggle with themselves, and after a number of sessions with training them on how to be more inclusive of the father, we've seen a much better outcome of men coming to the center. Even a higher increased number of men are coming now. In terms of the number of times these men visit, we found that over 69% of them came at least once, and a significant number of them came, I guess, again, additional times than once to the WREC visit. 100% of our focus group participants identified multiple roles for themselves as fathers and how they're engaged with their children through spending time with them playing games and talking. And also 78% of these participants in our survey live with at least one child. Now our survey, we were able only to capture 166 respondents because we were looking for 150 and we decided to go over and do 166. Just to get an idea in terms of program planning and being involved in the early stages of an evaluation of a program, engaging the site, but also engaging the participants and engaging the staff. We've also pulled together a number of stakeholders in the city of Kenosha, from people in the mayor's office to the health department to the Department of Corrections to the child support office to see how they can maybe better serve these men in a future program that we would like to plan in their work. And one of the reasons that I'm able to do this type of work also is that our university, the University of Wisconsin-Madison and Milwaukee, encourages all of their professors to do community engaged work. And they will give us at least $50,000 to do that over a year's time. So I was able to submit 3 different grants, thinking one would get accepted. All 3 got accepted. So I'm very engaged in the community right now. And we'll be glad when all they're done so I can do my other work, but I've enjoyed this one as well. If you look at, again, the racial breakdown, I've already said the majority of the men there were white who were coming through in terms of the breakdown. Then we had African American and Hispanic. In terms of their degrees, the majority of them had some college. Not majority of them had some high school, then second had some college, and some of them had college degrees, which I thought was very interesting as well. But again, this being a very depressed area around job procurement, it made it much harder for them to be able to work. In terms of them having a full-time job, 43% of them did have a job, which makes for a different population. Again, most of them were white. Most of them were Hispanic, again, so they were able to do other jobs that were available to them. And also their social networks were very interested in how they were able to procure jobs, which made it for a very interesting find as well. In terms of what did they find the most important needs for them, we found it very striking that the majority of the men said their biggest issue was food security. They found that they really never had enough food at the end of the month. in the households they were living in, or they themselves worried about how they were going to eat. And then financial needs became second, and employment was after that, which we found we want to explore and examine why is that at a WREC site where food is available, and they're living with the mother, a large part of them were living with the mother, why was food such a high need issue? And I've heard this kind of permeating throughout, or talked about throughout the country too, through other places I've been working at and doing research, that food is a big issue for many of these men as they look at their current lifestyle. Let's see. In terms of what they see in terms of support, of course, the number one thing of support these men said they needed were jobs. They would like to know about more father-child activities. That one thing is that in the focus groups and interviews, the one thing the men said to me over and over was, I want to know how to be a better dad, particularly because these men were looking at, this is men whose children are under 5 years of age, and they're not sure about how do you discipline your child in a way where they won't be, child welfare service won't get involved. How do you talk to your child? How do you bathe the child? How do you change a diaper? Even though it may seem like something that people may say that's common sense or you just learn how to do it, I can remember my own 2 children, how I had to learn some of that, and I thought I knew how to do it very well. And I'm still trying to figure out how to be a parent to a 21-year-old kid who just always is challenging me every day. So I think that is something that we all can learn how to do a better job of. But again, this is some of the things that the men had talked about in terms of whether they think they needed to be a better father. Going into my next, and if you want more information on that particular program and our work, we'll be releasing a paper very soon, and hopefully you'll get a copy of it, or it'll get published somewhere. So hopefully, but I want to move on to the next study that I was involved in. And in this one, Frank, who's the father of 2 people, said, well, for a year or 2 months, I was a computer or configuration technician. I had known you received 2 certifications, and that's how I got the job. I applied through the company, and once the company found out that I had a felony, they let me go. So the staffing agency, I think, might have lied to them saying that my background was fine. Many of these men are not, because they're not able to get what we call a steady job, they go through a staffing agency or a temp agency as a way to get employment. And staffing agencies are very popular in the cities of Kenosha, Milwaukee, as a way for many of these men to be able to deal with and also as another project that I'm working on where I got the grant for yesterday, I've been sitting in the courtrooms for the last year and a half and listening to how judges have now assigned these temp agencies as places for many of these men to go get jobs. And I find it as I don't know whether or not that's the right thing to do. I'm not saying it's a terribly bad thing to do, but it's also a setup for many of these men of failure because they feel after that 89th day comes around, I got a job on the 90th day, and they're often let go. Or these staffing agencies are not very forthcoming about how much they really are invested. At least these men feel they're invested in their lives for them around employment. So I really have a question whether or not it's the place to be telling men to get jobs, but at the same time, everyone needs to work and pay their bills. But this was a man who talks about how he really had a great job, but then because of his felony, he was let go. The program I'm going to talk to you about now is another one of those community university connections where I was looking at the intersectionality of health and well-being around employment issues. And I was always very interested about why is it that men are not able to sustain work or keep work. As a social worker in my previous profession in life, I did a lot of programming with men where I would get them jobs, make their lives, I would think, much better off. But would find after 4 or 5 months, or maybe sometimes 4 or 5 weeks, they were not on the job anymore for some reason that I could not figure out why. That has carried with me throughout most of my career to the point where I felt when I finally had a chance to do some research around it, I wanted to be able to look at who were these men, how would we define who these men are. So through the work I'm doing with Dr. Sopetsis in this particular project, we're doing a mixed method study with men who are 18 and over at a workforce development site that has 4 or 5 sites throughout the city of Milwaukee. Milwaukee as a city right now has a significant number of challenges for black families, particularly for black men. In the neighborhoods that I do my research in, the unemployment rate is as high as 75% for black men. To as low as only 50% for black men. So employment is a significant issue for men who are not very educated and don't have many resources. We were involved in some survey data collection that was unduplicated with 195 men during the period of August and September. We've done interviews and focus groups, and we're also interviewing some of the administrators, staff, and participants of this program to get a full mixed methods study and look at what really happens when you come through this program and you're seeking services for employment, since that tends to be the one thing that we hear everyone say that people should do, and they should have a job. I totally agree with that. But these men are really seeking it, but what's going on there? One of the things that we also have done is we have an advisory board of key stakeholders in the city of Milwaukee, from the health director to the mayor's office to the state ACF person. The Administration of Children and Families for the state of Wisconsin is involved, Eloise Anderson, in our project, because she has a significant interest in the issue of fatherhood and men being involved with their children. What we are looking at is a variety of measures. We're measuring their physical, mental, and behavioral health outcomes through a health survey, CDC survey, a BSI inventory, the adverse childhood experiences, as well as we're looking at their issues related to self-sufficiency, about whether they've been incarcerated and have had previous employment problems. What I want to do at this point in time, though, is focus on one thing that I was very interested in based on a conversation I heard last year at a conference here, was when Dr. Shankoff talked about adverse childhood experiences. What I did when I left here was that I decided that I wanted to really look at what do these men look like around their own adverse childhood experiences. Is that something that maybe has a correlational effect to why they're not able to do many of the things that we would like them to do in their own lives? And some of the questions that we're asking is what is the health status of African-American men seeking job services, as indicated by the physical, mental, and behavioral health outcomes? What is the prevalence of various adverse childhood experiences among these men seeking job services? And how do African-American men seeking job services in Milwaukee characterize their early life experiences, current life status, and employment-related challenges? So what we did was we decided to go and look first at the CDC ACE study, the Average Childhood Experience Study, and we wanted to see how does that study, who looked at primarily white men in San Diego, had a very large sample, but they only have 3,000 of those were men. How do the men that I'm looking at in Milwaukee compare to that sample? And this is what we came up with in our two sites, and I don't know if you can see it as clearly, but I'll explain some of the things that I thought were really very key. We have two Midwestern cities we're looking at, St. Louis and Milwaukee. In the ACE study, if you look at some of the abuse issues around verbal, physical, and sexual abuse, we were very surprised by the high rate of sexual abuse that the men reported, and also the high rate of physical abuse that the men reported. If you look at the ACE study, which is primarily white men, the verbal abuse is 7.8%, where in our sample is 38% in our site in Milwaukee, and it's 21% in our site in St. Louis. You look at the sexual abuse that has been reported, and generally this is what we were surprised because this is something that, one, men are generally underreporting this particular area, but for this population of primarily black men, we found that they reported 21% of them had experienced some sexual abuse. And in my interviews and my focus group discussion, sexual abuse has come up surprisingly very easily. What these men have talked about. And I, as a social worker, have to figure out how do I deal with this? As a researcher, how do I handle this? This man is being very open with me about issues that I just don't know how to personally deal with. But it's been something I think has been one of the most telling parts of our project, is to hear about some of the abuse that they've had to deal with. Around the issue of neglect, we're not really sure why our site in St. Louis is very low. In our site in Milwaukee, the amount of emotional abuse reported is very high, 38%. And then the physical abuse in our St. Louis site is much higher as compared to the site in San Diego. If you look at household dysfunction around whether there's been a battered mother or a household substance issue or mental health issues or divorce or incarcerated household membership, those numbers are just very, very high. Unfortunately, these men are experiencing some adverse childhood experiences that are just much higher than the population for which the study was done. And in my look at if anybody has looked at this issue, I've seen that people really haven't looked at whether or not these men bring a number of issues. You hear about it a lot, but I think that what we have found is something that I think is going to be really helpful as to how do you look at preparing these men or helping these families in the future to be better parents and better providers and more engaged in their life of their children. Also, with the ACE index, you look at whether they've had 0 experiences, 1, 2, 3, 4 or more. And as these numbers show, our sites have had sometimes lower experiences, but what we have found is that these men tend to have 4 or more experiences of adverse childhood experiences from the ones that I listed in the previous slide. It's not that they'll have one or two of them, but they have a number of adverse experiences. And I've had a number of men who I've interviewed who have talked about sitting next to a friend who just got shot in the head and they have to deal with that death. Or the number of deaths in their families they have to deal with on a regular basis. Someone is always dying because they have poor health or lack of access to a healthcare facility, or they just have something that is traumatic that they have to just keep moving forth on because they live in violent communities. And again, I want to say that even for many of them, poverty is seen as a very violent issue because they can't attain the same things that many of their friends or people they see on TV attain, which is a big issue. The last thing I want to do is something that I want to talk about. I wasn't a part of the research, but I was someone who was very engaged in helping them talk about something, a report that just came out called What We Want to Give Our Kids, which is all about the issue of child support as a social welfare policy, but how does child support affect a certain group of people in their lives around the issue of legacy and wealth and assets? What the study is called What We Want to Give Our Kids. It's a joint report by Insight Center, which is Closing the Wealth Gap Initiative, and the Center for Family Policy and Practice, for which I've been very intimately involved for the last 20 years. What the study did was look at 35 fathers across the country in 6 different cities. They were average age of 34, had 2 children. 26% also care for support of another child. 74% of these men live with a relative or a partner. 9% of them were currently married. 71% of them had a high school diploma, a GED or higher, and 22 of them had the median age of when they became a father. What this particular report does, and it's available to you, and I have a handout if you want to get a copy of it off the web, is that it's for the first time, it's looking at how does a certain policy, which is well intended to get needed cash to a custodial parent, is maybe causing some issues that could be very detrimental to the life of a family around their own availability to accumulate wealth and assets. It's a very different way of thinking about child support. It's a very different way of thinking about how it could help a family. But one of the things that what were the 5 themes that came out in this particular report is that they found that if they thought child support pushed poor families deeper into poverty, because many of these men were already poor based on some of the fact that they may have had default orders that made no sense. They may have been imputed orders that made no sense. And also these were families who just really already were poor, and so therefore, how do you handle that? The other one was it can interfere with fathers' consistent engagement with their sons and daughters because there may be a mother on one side who's very angry about the fact that she's not getting any child support. There may be also a man who's very fearful of the fact that if he comes around, there will be some issues with them engaged in their child. But also, it's also a clear not understanding of how the policy works. In terms of the policy, the child support enforcement policy, for a variety of reasons, as the law states, has to recoup dollars if it's connected to TANF or formerly connected to AFDC. So again, some miseducation between the two parties can be an issue. The policies and practice can impede long-term financial ability in terms of your credit, and also how you can have liens on your house, liens on your car, liens on a variety of things. And also the aggressive child support enforcement practices can diminish job prospects. In terms of whether or not, I know, for example, in Milwaukee, if they see on your record now or in your history that one of your biggest issues that you have arrears for child support, they don't hire you. As someone who has myself faked, as I do in some of my qualitative work, I'm looking for a job as one of those men, and I fake a credit report. They say they don't want to hire me because they said, what's this big debt you owe? I don't want to be paying that. And it's a real issue that these men deal with on a regular basis. And also, child support debt can compel a father's relatives and partners to jeopardize their own economic security. My last project, the last thing I'm going to say before I was told to stop, is that the project I'm working on now with the professor, Tanya Breedel, who's at the law school, is that we have been looking at courtrooms, and we have been looking at the child support system as to how does the child support system decide when does someone go to jail for non-payment of child support? When are you held in contempt? And I have to say, it's been very interesting to see that when they want you to do a purge payment to get out of jail, it's not often that man is paying that debt. It's his grandparents, it's his aunt, it's his uncle, it's his cousin, who also may be poor. And so therefore, this whole idea that you can have a family that is trying its best to make ends meet, but because this particular policy may have some unintended consequences to other family members, it's jeopardizing the legacy for that child. So we've been very excited about this work. We have our first article we're about to submit to a law journal this semester. This semester's over, thank God. This summer we're submitting our first article, a law review article. I've never written a 70-page law review article in my life, and that's been quite an experience. At least my colleagues have written most of it because she's a lawyer and she knows what she's doing. And I will tell some of the story that we're learning, but we're looking forward to the next 2 years of our NSF funding to allow us to do more exploratory work and examination ethnography as to how does the system, the courtroom system, the court system really kind of exacerbate some of these issues of poverty and debt that these men and families are accumulating. Thank you very much, and I look forward to your questions.
Thank you all for those remarks. So many different components that we hopefully will have a chance to dig into as a part of your questions and being up here to facilitate this question and answer session. So let me invite those of you who have questions to come up to the microphone. Make sure that you please just ask one question at a time. We also have potential questions from the live stream through email or the other methods that have been provided. And so if you have questions that way, make sure to send them in as well through the live stream. But let me start off with one quick question right off the bat. You guys have all highlighted different components, things that you were interested in, found interesting. What do you find was most surprising about what you guys have found in the research that you're doing, have done, especially as it relates to men and that transition to adulthood and to parenthood?
So the very first young man we interviewed in Camden related a story of becoming a father while he was still in high school. And as Tim said, we really thought, we kind of bought the popular diagnosis of father absence. And when he told us that when he heard the news that a woman he was no longer with was pregnant, he acted disappointed to his relatives, but ran up to his bedroom, slammed the door, and began dancing around the room, shouting, "Thank you, Jesus." We knew we were in for a very different experience than we had thought. So that moment, we kind of received with disbelief. Okay, here's one guy for whom fatherhood was a potential turning point. He really saw an opportunity to turn his life around, to be generative, to give to another person, to do for a child what his father had never done for him. But as we interviewed more and more men, spent 7 years in these communities, living in one of them, East Camden, for 2.5 years, we really saw the power of the potential power of fatherhood in men's lives. We know how fatherhood now affects brain development. It really transforms men's brains in ways that might make them not only better fathers, but better employees and better partners. And so we were inspired by these good intentions, and also crushed by the way in which the process of relationship formation seemed to be defeating all of the good that could have come from these father-child relationships.
Yep.
Yeah, I guess everything Kathy said, but it's not just the relationships and how they're formed that present such a huge obstacle, but just the environment, the neighborhoods, the institutions, all these things that conspire, and including these fathers' own family backgrounds, as David was talking about. There's just an incredible amount of resistance to these guys actually becoming the fathers that they really do want to be.
I guess the one thing I mentioned earlier is that the amount of violence people live under that I just did not, and I just didn't realize how deep that was for everyone. Not just even these men too, but even the people who work with the men. They live in these communities, and then they're also having to deal with these issues of how do they process that, how do they move through, how do they process it, but also themselves normalize it in a way that they're not taking it home and having to deal with it. So that was something for me that was very difficult to have to hear, that it's such a big issue, and the challenge is very big, so it's good that we have this opportunity to talk about it.
Any questions? Yes.
Thank you for a really amazing panel and for your work. I know that from a kind of normative perspective, we are supposed to I guess, fall in love, then want the child, then plan it, then make it happen. but I think your narrative suggests that reality may be a lot more complicated. What my concern is about the kind of class nature of that. Your observations were of lower class men that are undergoing really difficult kind of economic and other circumstances, violence. I don't know if you had a chance to observe otherwise middle class families, lower middle, upper middle. But my sense is that the normative pattern isn't as common as we think it is, though income allows you the possibility to create some performances around your relationship that make it suggest that there was a sequence that was supposed to be, but that may not have been the reality of the sequence, right? I don't think every middle upper class person that's married is married out of love. I don't think every kid that's timed particularly well or not. And again, this is just non-scientific, casual observation of men of various backgrounds, and I'm not speaking from personal experience, right? But just do a age of birth of first child and date of marriage for the general population, and I'm sure you'll find more complication than the normative story would suggest. So is this a story of values, or is this a story of resources? And how resources allow you to engage in some kind of social performance around the norm that you can get away with if you're upper class, but you cannot really get away with if you're if you're lower class.
So, yeah.
So Charles Murray, in his recent book, has really told a story of values. And if you read Doing the Best I Can, and if you go on the website doingthebesticom, there is a special discount code for the book. You will see that we really tell a story of resources. The class divide is profound, and what we find is, if you're really telling a value story, you might expect to see this pattern being particular to a specific racial or ethnic group, right? That's kind of the story that we've heard. Indeed, what we see is that whites, blacks, and Latinos are really telling it, with constrained resources, are really telling very much the same story. Everyone in society wants to be a father. Fatherhood, as for all Americans, has grown in salience. In many ways, these fathers can't afford to do relationships right, so they do them the best way that they can. That's the title of the book. So this comment is really prescient. I will say, however, that the divide is growing wider all the time. The age at first childbirth for the highly educated Americans is now into the 30s. It is 21 for women and 22.5 for men who ever have a non-marital birth. So you see a decade divide. Disadvantaged folks are having kids much earlier. They're having them in much more fragile circumstances. Married couples with a college degree are actually growing more and more stable in their marriages over time, whereas the marriages that do occur among less educated folks are actually growing more fragile, so you have a marital divide. Of course, you have the divide in non-marital childbearing. And while it is true that about half of those non-marital births are to cohabiting couples, these couples are extraordinarily fragile. So more and more we see this divide in resources translating into dramatically different family lives, which not only affect children, but also affect these children's parents, including their fathers, in ways that pose major challenges to American society.
Just related to the values question, so we asked the fathers we interviewed, what's the ideal time and circumstance to have a child? And overwhelmingly it was, well, first you should finish school, and then you should go to college, and then you should get married, and then you should have children. I didn't do it that way, but that's the right way to do things. And in terms of ideals, it's amazing how often the television show Leave It to Beaver came up. And these guys are not born, a lot of them, when that show was on the air. So, but this conception of the ideal family and the ideal time is alive and well in this population, but they feel it's something that they just can't accomplish given their resources and their environment.
I also agree with Tim and what Kathryn said. I definitely think it's an issue of resources, but I think also it's just what I've seen in many of the communities, white, black, Latino communities who are poor, is just a matter of what is your social networks that allow you to have any resources. And it could be a resource to I can work at the gas station that my uncle owns, to I can do what everyone else does in my neighborhood because they don't have a job, and whatever that might be, legal or illegal. So I think that it comes down, for me, it may be some issues of values, but those values that may be normalized in a community where it may be what you might call dysfunctional, but is also maybe what's normalized for that community because that's what the community knows, because they don't have very many resources. So it's a very complicated issue. I'm not going to say it's either or. I do think it's intersectioned, or there's some intersectionality going on between the both of them, because I do talk to a lot of men and women who have the same values that I've had as someone who's became more educated and more exposed and had more opportunities. But everyone wants to raise their children in the best schools. They want to do the best they can for their wife or girlfriend. They want to make their mom or dad proud of who they are. But if they don't have the resources that I would have, it makes it much harder. And also, who's defining what's the value? You know, that's the big issue here for me always. I'm always wondering who's defining or imposing on this community what's the correct value. And is that really just and fair in our current life, in the current society? So that's a question I would pose as well. Who is defining what is correct? So I'll leave it at that.
I think one of the things that we can look at as a part of this question too is how can we resource these young men? How can we put those resources into their life, both skills, both relationships as well, but then also thinking through how we can leverage that encouragement, leverage that excitement that they have towards some of those goals, towards some of those resources, and mobilize action, mobilize decisions based upon some of those opportunities as well. So, next question.
Okay, I just wanted to say how well promises I can keep and doing the best I can dovetail. And one of the things that strikes me, having attended a number of fatherhood conventions, meetings, and so on, is the anger that's there toward their child's mother, their children's mothers. It's very strong, coupled with the desire to, as you point out, be a good father, which is defined, as you point out, solely in terms of, not solely, but primarily in terms of emotional support. These are things that the current fatherhood effort seems to support. Perhaps introducing ways of getting along with the mothers a little better. But could you address this issue, the mother as gatekeeper, how it relates to fathering, and possible ways to address it?
So, you know, when you talk to moms, Promises I Can Keep was the parallel book on the moms in these communities, which we published before the book on the dads. When you talk to moms, they say, well, dad doesn't visit because he's a deadbeat. When you talk to the dads, they say, well, I don't visit because the mom is acting as a gatekeeper. So we put this deadbeat dad, gatekeeper mom sort of contest to the empirical test using the Fragile Families and Child Wellbeing Study. Laura Talk is the first author of this paper. It came out a couple of years ago in Demography. And what we find is a really interesting story. When mom transitions to a new partner, this is the strongest prediction of declines in father involvement, even above incarceration history and employment and earnings. And when you go to the qualitative data, what you see is that when mom tries to keep that new relationship together, having her old boyfriend come and visit the child creates a lot of drama in the household and actually puts her new relationship at risk. So that picture I showed at the beginning of these highly complex families, it's just very, very tough to stay engaged as a parent and not disrupt that new relationship. And if there's a child in that new relationship, you're really pitting one child's interests against another. So we do describe and discuss maternal gatekeeping. I do think some fatherhood programs that we've been observing across the country do a very good job of training fathers to be better parents, and this can give comfort to mothers and more confidence, give mothers more confidence that it's safe to let the child go spend a day with a dad rather than having to be sort of underfoot in her household. But we need to really, really focus on the co-parenting relationship. Unfortunately, when we only treat one part of the problem, so if a fatherhood program only has the father in the room, we're not really going to solve it very effectively because we don't also have the mother there. And mothers need, mothers often think they can substitute dads. We call this swapping daddies in the book, because their new partners are often have more human capital than their old ones. There's a sort of a learning curve in partnering, and they do sort of trade up over time. Several studies have found this. So it's really tempting to trade the out-of-work caterer for a part-time mechanic, right? It looks better. You're going to give your child sort of a better father. The problem is that man is no more likely to stay around than the child's father. So you put children on a father go-round with no adult male involved in their lives over the long term, and nobody around to pay the college tuition.
Yeah.
I also want to say, as someone who ran fatherhood programs, many of the fatherhood programs that I've seen in the country as of late are not what I would call a traditional fatherhood program. One of the things that we were required to do in the early days when Vice President Gore started his work in whatever year that was, when I was much younger, we'll say that, we were required to engage the mother involved and involve her in the program. And it's not because he said that, but we felt as a group that was something we really wanted to do, was to be sure to encourage the mother was involved, to reduce some of that anxiety and stress around what is he doing and how is he involved with the child. And so I think some of it's a whole idea of redefining really what is a fatherhood program, because it has a number of components that people like Joe Jones is doing, and Wallace McLaughlin and Halbert Sullivan, people who I've known for years who have done fatherhood work and still contend and hold very high some of those relationships that are very important. And some people even in the audience here who I know do fatherhood work, who have done fatherhood work, will say that it's a very different fatherhood program that I see now versus what was before. And we really, I just really think that is also one of the things that I have to say, and I'm not trying to harp on this, sometimes many mothers or fathers don't understand how the social welfare system works. When you're a poor person and you're engaged in trying to use, for instance, the TANF program, and you're required to assign your rights to child support, and the man thinks that you call child support on me, and people don't understand how that can be so stressful to people's lives because they don't understand policy. I understand that because that's what I study. But people on day-to-day work, day-to-day lives in these communities don't often understand that there's some requirements in order to feed your child that you have to do. And that may not be what is the best way, but it's the way that's the current system right now. And so I think that we need to really examine what's at cross purposes here around our current social welfare system and parent relationships, because I think that could be some of the issue as well. But I just want to say that.
Next question.
Fantastic panel. Thank you very much. Dr. Edin, you talked about how to capitalize on father thirst by removing significant, substantial institutional barriers. And I'm wondering if you can say more about that, or any of the panelists.
Well, I mean, David has seen this in operation. I've too sat in the child support courtroom. When we adjudicate support orders for married men, right? We adjudicate visitation at the same time. It's a process that occurs by virtue of the fact that the couple is getting divorced. In many jurisdictions, as you know, there is no corresponding automatic process assigning visitation when we assign child support. So that's one barrier that I'm going to spend, Tim and I have been harping on for a long time, but fathers see this as taxation without representation, right? They want to be engaged, they want rights, they want to make decisions. The way to sort of capitalize on this father thirst is when it is safe, and we cannot presume that just because these men are disadvantaged and minority that they are not safe, right? Which is what we do. So we need to presume that they're as fit as any white middle-class father, and we need to assign them the same rights as well as the same financial obligations. That would be the primary barrier, but really every institution in our society is set up to assume that an unmarried family consists of a mother and a child. The work David has been doing in the WREC clinic is brilliant. All of these men showing up at WREC and the assumption is that they don't exist. So we can begin incorporating men at every level, welcoming them, embracing their engagement, treating them as parents and not just paychecks. America needs an attitude change with regard to these fathers. So that's what we would prescribe.
David, just from your, and that's also from the WIC, I think part of what we're talking about too are these institutional barriers. I think we've talked about it in some of the work in maternal and child health in hospitals as well, just thinking through some of those challenges. So David, real quick.
You got a big old stop sign.
I know,
there,
I'm jumping over that. I'll let you go get the last word.
No, I wanted to say one thing that Kathy said, because I know some of the people in the audience who are child support people might say, no, we don't do that. But for low-income men who are low-income getting TANF, they do not have a visitation order. That's a very separate thing. In the courts I've been in, they say go somewhere else for the visitation order. So I wanted to clarify that for a child support person jumps on me and says, we don't do that. And I wanted to clarify that because they don't. But in terms of in terms of the WIC stuff that we're doing, I think it's really important that we also acknowledge that these men are really trying their best to be the best father they can when they don't have an employment as their way of defining who they are. Mm-hmm. So they use other opportunities to say, this is who I am as a father, this is who I am as a man, this is how I want to be engaged. And they also are doing it by going through the Workforce and Development Office, trying to find a job. How often in a place like Milwaukee where they say we want to find you a job, there are no jobs. So what are you talking about? Because these men are getting a message, you come here for a job, but there are no jobs. And so when I talk to the employers or I talk to the staff, they themselves are also frustrated, but they have a job to do, so they do soft skill, and they do resumes, and you should dress up, and you should brush your teeth, and all that stuff, and they know that. But also one thing that we haven't talked about, and I know what you want to end, one of the biggest issues I've found across all these men, there is a very big need for housing. These men have nowhere to live. So if you hook up with a woman and you're heterosexual, you're going to have a baby. Generally you're going to have some kind of sexual thing going on. I know this is early morning, we want to keep it PG. But unfortunately, that's a real issue for many of these men. There isn't a housing policy that looks at single adults without children. And that's a big issue for many of these men, or the fact that they have a credit rating based on they haven't paid their child support, or they just have not paid the payday loan, things that also causes major problems for them. And I think that we need to look at that as a big issue, and someone needs to really research it. I don't have any money to do that, looking for some. But housing, this issue of housing and men is a big issue. And in terms of how do they deal with their own self-sufficiency and well-being. So.
Yeah. Just two things related to administration policy. There have been budget proposals that would address some of the things that Kathy's talked about, which are being put out by the Office of Child Support Enforcement, really talking about getting over some of these institutional barriers, connecting visitation and child support orders, looking at some of the ways that we can change laws there so that states can implement reforms and changes, but other states are exploring different ways that they can do this as well, and it's important to note those reforms, those changes, as well as where child support programs are engaging fatherhood programs, creating fatherhood programs, sometimes receiving fatherhood program dollars to do some of this work in their populations as well. So thank you for your questions. Sorry we weren't able to get to, do we have time for one more? Or no, we don't have time for one more. We're sorry, we won't be able to get to that one. Let me just end with some words from the president, because I want to echo these words from his remarks and I think speak to where we can go in this space. He says, we will beat the odds. We need to give every child, no matter what they look like, where they live, or the chance to reach their full potential. Because if we help these young men become better husbands and fathers and well-educated, hardworking, good citizens, then not only will they contribute to the growth and prosperity of this country, they will pass those lessons on to their children, on to their grandchildren, and start a different cycle. This country will be richer and stronger for generations to come. Thank you very much.